So we'll quickly talk about Omphalocele. I think previously we spoke about gastrochesis because students tend to be confusing them. So just so you know, Omphalocele, the abdominal content is protruded, but is covered by a peritoneal layer. While in gastrochesis, there's an abdominal defect and everything is protruded out and there's nothing covering it. That means the defect also affected the peritoneal layer. Do you understand? So the Omphalocele is just known as a congenital issue. That means a baby is usually born with it. So they are born like this, So abdominal organs like intestines, liver, the stomach, they are protruding through the belly button. Please, you should note this. It's not just a defect on any side of the abdomen like gastrochesis. This is another difference. Omphalocele must come out from the belly button. That's your umbilicus. Okay. So it's a type of abdominal wall defect. It develops during early pregnancy when the abdominal cavity doesn't form to close properly. So what causes it? So let's explain what the pathogenesis now. So normally the intestines temporarily push into the umbilical cord between week 6 to 10. Okay, but after week 11 they will return back. Do you understand? But in Omphalocele they fail to return back. So this is a normal process when you are developing. It comes out, it goes back. Do you understand? But when it fails to go back, that's why we say there's an Omphalocele. So Omphalocele, it must push out through the belly button. Alright. So the exact cause is not known, but it's linked to several disease conditions like trisomy 13, 18, 21, which is Down syndrome, or maybe the mother was having some underlying disease conditions like diabetes, she was obese, she was abusing alcohol, maybe she was smoking, maybe she was using some 1 or 2 medications, antidepressants. So side effects of those lifestyles or those drugs. So what's the diagnosis? Prenatal ultrasound is often needed because you want to view the baby. Right? High alpha fetal protein levels will be recorded. Okay? Amniocentesis and fetal MRI help access associated abnormalities. So this is a surgical correction of it, right? Where they basically do an incision, then they push it back. So complications. If you leave an Omphalocele, there's an infection risk, right? Underdeveloped abdominal cavity, making surgery more complex. So it's often associated with babies that have this. They can also be having heart defects, neural tube defect like spinal bifida, Beckwith-Wiedemann syndrome, chromosomal abnormalities. Treatment. So surgical repair is essential, right? It's not a drug issue. It's a surgical issue. So small Omphalocele, organs will be returned. Then the abdominal cavity is closed up with stitches. All right. Then large ones, okay. For large ones, you have to allow the baby to grow further, to be able to absorb the tension of the surgeries, So that's just it for this Omphalocele congenital condition.